How to drink alcohol without crushing your testosterone, the holiday survival guide. First, let's look at the biochemistry, because I want you to understand the why before we get to the how. When you consume alcohol, your body views it as a poison. Your liver drops everything else it is doing, including metabolizing fat and regulating hormones, to process the ethanol. It converts ethanol into acetaldehyde, which is actually more toxic than the alcohol itself. This process increases oxidative stress throughout the body. For men, the specific danger lies in how alcohol interacts with the endocrine system. Acute alcohol consumption can lower testosterone production in the testes and increase the conversion of testosterone into estrogen. This happens because alcohol stimulates an enzyme called aromatase. Think of aromatase as a thief that steals your hard-earned testosterone and turns it into estrogen, which is the last thing you want if you are trying to maintain muscle mass, libido, and drive. Furthermore, alcohol destroys your sleep architecture. You might pass out faster, but you miss out on REM sleep and deep wave sleep, which is the exact window when your body produces its natural testosterone and growth hormone. So, if you drink heavily and sleep poorly, you are hitting your hormones with a double whammy. However, I am a realist. I know you are going to celebrate. So, how do we mitigate this? Step 1 is choosing your poison wisely. Not all alcohol is created equal when it comes to hormonal impact. The worst offenders are beer and sugary cocktails. Beer is highly estrogenic due to the hops, and the massive carbohydrate load spikes your insulin. High insulin is a direct antagonist to testosterone. Sugary cocktails, margaritas, mojitos, anything with simple syrup, are even worse because the sugar crash combines with the alcohol to create massive inflammation. Your best bet is to stick to clear spirits like vodka, gin, or tequila, mixed with soda water and fresh lime. This keeps your insulin stable and minimizes the toxic load on your liver. If you prefer wine, stick to a dry red wine, which at least offers some resveratrol, but keep it in moderation. Step 2 is hydration, but not just water. Alcohol is a diuretic, meaning it flushes minerals out of your body. When you lose magnesium and zinc, your testosterone production suffers immediately. My protocol is simple. For every alcoholic drink you have, you must drink 1 large glass of water. Ideally, you should pre-game your night with electrolytes. Taking a high-quality electrolyte supplement before you go out ensures your cells stay hydrated, which helps your liver process the toxins more efficiently. I also recommend taking N-acetylcysteine, or NAC, about an hour before you start drinking. NAC is a precursor to glutathione, your body's master antioxidant. It helps your liver neutralize that toxic acetaldehyde much faster, protecting your cells from damage. Step 3 is managing your food intake. The drunchies, that urge to eat greasy, carb-heavy food after drinking, is a trap. When your liver is processing alcohol, your fat burning is turned off. If you eat a pizza or a burger while you have alcohol in your system, your body has no choice but to store that dietary fat directly into your adipose tissue, specifically around the belly. Visceral belly fat is a metabolic organ that produces inflammatory cytokines and, you guessed it, more aromatase. So, if you are going to drink, try to keep your meal focused on lean protein and vegetables. Eat a substantial meal of steak or chicken before you start drinking, so the alcohol is absorbed slower, and skip the late-night drive-through. Step 4 is timing. The earlier you stop drinking, the better your hormones will fare. If you stop drinking 3 to 4 hours before bed, your body has time to process a significant amount of the alcohol before you hit the pillow. This gives your brain a fighting chance to get into those restorative stages of deep sleep where hormonal recovery happens. If you drink right up until the moment you pass out, your sleep quality will be garbage, and your cortisol, the stress hormone, will be sky high the next morning. High cortisol suppresses testosterone. It is a vicious cycle. Finally, let's talk about the morning after. Do not lay in bed feeling sorry for yourself. Movement is the best way to get your lymphatic system moving and detoxify. Go for a walk, get some sunlight in your eyes to reset your circadian rhythm, and do a cold plunge if you have access to one. The cold shock proteins help reduce inflammation. And most importantly, do not try to starve the hangover. Your body needs nutrients to repair. A breakfast with eggs, which provide choline for the brain, and maybe some avocado for healthy fats, is a great way to stabilize your blood sugar. Now, if you are listening to this and realizing that you struggle with low energy, brain fog, or low libido even when you aren't drinking, or if you feel like your recovery from the holidays takes weeks instead of days, there may be a deeper issue at play. Alcohol makes things worse, but it shouldn't leave you broken. You might be suffering from clinically low testosterone or a hormonal imbalance that no amount of kale smoothies or dry Januaries will fix on its own. At LifeWellMD, we look at the whole picture. We don't just guess, we test. We look at your free testosterone, your estradiol, your inflammatory markers, and your nutrient levels to build a roadmap specifically for you. We serve patients all across the Palm Beaches and the Treasure Coast, helping them reclaim the vitality they thought was gone forever. This holiday season, enjoy yourself. Celebrate with your friends and family. But do it with a strategy. Protect your sleep, choose the right drinks, stay hydrated, and respect your biology. And if you are ready to make 2026 the year you finally get your edge back, I want to help you do it safely and effectively. Call my office today. We have locations in both Palm Beach and Port St. Lucie to serve you better. You can reach us at 561-210-9999. Whether you need an in-office consultation or a telemedicine appointment from the comfort of your home, we are here to guide you. Don't wait until you are burnt out in January. Take control now. Call Dr. Kumar at LifeWellMD at 561-210-9999.